Hi, this is Dr. Motwani. Today we're going to talk about repairs or reconstructive repairs of corneal transplants. Corneal transplants are done for various reasons. They're done when the cornea fails, either through disease, corneal disease, through trauma, or something else that really prevents someone from getting a good image or light passing through the cornea, so that the retina, the back of the eye, the nerve layer of the eye that sends the image to the brain can actually receive a good image. And corneal transplants are done for diseases like keratoconus, other corneal ectasia. They're done for diseases such as in the past that have caused the endothelium or the inside part of the cornea to actually fail. Now we do partial thickness cornea transplants, and now we do transplants of of the endothelium on the inside. But today is different than the past, and there are a lot of people that have had corneal transplants in the past. And corneal transplants are essentially a cadaver, a cornea from a donor that is cut out, and then you cut out the recipient's old cornea and sew the new one into place. Yes, there are definitely mismatches, irregularities created by the fact that the cornea that's the recipient is a different shape than the cornea that's a donor. There's mismatches created, or irregularities created, when you're putting stitches and sutures into it. And so, we get a clearer path of light going in, but the irregularities can scatter the light and cause serious vision issues. Not a lot's been able to be done with that. You can wear scleral lenses, contact lenses. They try relaxing incisions and relaxing sutures, but the best way to deal with this is to actually reconstruct the actual cornea shape, to remove the irregularity by topographic guided ablation. What we do with that is we map the irregularities, run it through a system like wave-like Contura, and we actually see and segmentally reconstruct, remove the tissue that's irregular to create a smoother shape. This can have dramatic effects on correction, refraction, vision, halos, glare, streaks, doubling, ghosting, and create much more regular corneas within that specific cornea. I have a patient we did this for, and the interesting thing is their cornea is now the inside, the cells are failing, so it's getting a little swollen. Well, because of the updates in technology, they're going to replace the interior corneal endothelial cells with DSEK, but he gets to keep his nice, newly shaped cornea for the first time in years. He does not have the streaking, the halos, and all the crazy correction he had. He had like 4 or 5 diopters of astigmatism. He had like 6 diopters of hyperopia. And when you create that new cornea, you're creating vision that's much more normal, which can return people to normal activities and normal lifestyles and normal careers. And so there's a lot of hope for these patients if the correction is done in this topographic guided ablation.